Hi, my name's Alex. I'm a physical therapy assistant student from Colby Community College, and today we're going to go ahead and talk about some fractures. So, fractures are defined as a break in the continuity of a bone, an epiphyseal plate, or cartilaginous joint surface. Fractures are normally diagnosed with some kind of imaging, like an X ray or a CT scan, but they can also be diagnosed with an ultrasound or a tuning fork. Fractures can be direct, indirect, or from a pathological reason, such as some kind of disease, or maybe they inherited some kind of disease with that. Some of these diseases can include osteoporosis, which is just loss of bone due to calcium not laying on bones. It's really common in elderly people. Um, Paget's disease, osteolytis, leading to bowing of the bones, which can cause your legs to like have like a bone deformity. Osteochondrosis, disease of growth center in children with resultant degeneration, necrosis, followed by regeneration and recalcification. Um, Four is osteogenesis imperfecta, which is inherited. Basically, the bones become brittle and begin fracturing at birth when the child starts weight bearing. So basically, your bones would just become, um, really fragile. Easy, can break a lot easier than normal. Rickets is going to be from like a vitamin D deficiency. Your bones is not getting enough vitamin D. You're not keeping enough, storing enough vitamin D in your bones, which can also cause them to become weak. Osteomyelitis, which is a bone infection. So yeah, just bone infection. Osteosarcoma, which is basically sarcoma is just another word for bone cancer. Um, Symptoms include of bone fractures may include pain, manual muscle guarding, swelling, redness, fracture blisters, grating with movement, deformity, and loss of function. So a way that they would normally treat that, they're going to reduce it. So normally when you fracture a bone, it doesn't just break straight. Normally it like curves off to the side or out one way. So if that's the case, then they're going to reduce it, which just means straighten it back up. And then after that, they're going to fixate or hold the reduction either internally with screws, rods, or nails, or externally with like a cast, a sling, a splint, or a wrap. And then the next step would just be to rest for 4 to 6 weeks if you're a child, 6 to 8 weeks if you're an adolescent, and 10 to 8 weeks if you're an adult. And then the next step after that, after those 8 weeks are up, then they're going to start the PT process of restoring function and getting everything healthy again. Um, so there are some complications, though, that come, some secondary complications from fractures that you may get while you're trying to heal the bone fracture, which is, you can get infections in the bone or the blood, swelling, avascular necrosis, which is basically a rotting of the limb. Um, Basically, it's not getting enough blood supply because it's cut off. It's basically what avascular means, and then necrosis means to die. So the limb or just area just dies, and then it can also have like a deep vein thrombosis or basically a blood clot. So the rehab protocol would normally be, after the 8 weeks is up, when they first start out, they probably might like, ice, modalities, to help with like if there's, still a little bit of swelling or pain, can help with that. They're also going to do some strengthening because if they've been having a cast on for several months, then they're going to have atrophy of their muscles. So they need to regain strength back in those muscles. They're also probably going to do like some coordination and stability stuff, some functional, movements depending on what the fracture occurred. If it happened in the leg or something, they're probably going to work on a lot of coordination and like strengthening of the hips and then down by the ankles. So, yeah. Well, thank you very much. I appreciate it. Thanks for listening.